How I Made Health Happen at the Reno VA Medical Center by David Patterson. The Veterans Health Administration is America's largest integrated healthcare system, providing care at 1,243 healthcare facilities, including 172 medical centers and 1,062 outpatient sites of care of varying complexity, serving 9 million enrolled veterans each year. The VA's mission statement is to fulfill President Lincoln's promise to care for him who shall have borne the battle and for his widow and his orphan, by serving and honoring the men and women who are America's veterans. At any given time, 1 in 25 inpatients have an infection related to hospital care. These infections lead to thousands of deaths and cost the healthcare system billions of dollars each year. One of the factors that can lead to a healthcare-acquired infection, or HAI, is a healthcare setting that isn't properly cleaned and disinfected. Wasted patient time can also lead to less satisfaction and even lost wages for patients. Overly expensive inputs are similarly wasteful when expensive resources are used when cheaper ones would suffice. This is the main storage room for the CLC. As you can see, the lack of organization made it difficult for nurses and CNAs to have access to the equipment they needed when they needed it. Another problem was that the lack of organization led to the issue of not knowing what equipment the CLC had and what equipment was still needed by the CLC. This room is also supposed to be a clean storage room, meaning all equipment needed to be sanitized before being put back in storage. Yet there was no process of knowing whether or not sanitization had been completed. This is another storage room we worked on. Many times, the CLC will leave behind walkers, wheelchairs, and other medical equipment. If it wasn't VA property, we ended up throwing out the equipment that was left behind. In an effort to make health happen at the VA, I performed a 5S project on the main storage room in the CLC. The goal was to clean, organize, and maintain the storage room so that nurses and CNAs could provide safe, quick, and effective healthcare to the CLC patients. 5S is a lean tool that creates an organized, clean, and safe workplace. Sort means to clearly distinguish needed items from unneeded items and eliminate the latter. Set in order means to keep the needed items in the correct place to allow for easy, immediate retrieval. Shine means to keep the workspace orderly and clean. Standardize means standardized cleanup. Sustain is when you make a habit of maintaining established procedures. As you can see, the CLC has come a long way since the day we first started the 5S project, when you couldn't even walk into the storage closet. Although the project is ongoing, we have made significant progress in creating a safe, organized, clean storage closet for the nurses and CNAs to use.